we have an agenda to adopt. First off, moved by Director Inkster, seconded by Director McMahon. Any conversations around the agenda? It's straightforward, one item really. No, seeing none. All those in favor? The motion carries and our agenda is adopted. We do have, the presentation, the materials for the presentation have been submitted to us, so I'll just ask for a motion to receive the materials for this meeting. I see Director Toff, seconded by Director Inkster. All those in favor? The motion carries. And we have minutes from April 24th, 2025 to adopt as well. It's moved by Director Inkster to adopt those, seconded by Director Gabias. Anything on the minutes? No. All those in favor? The motion carries. I try to slow things down compared to how speedy I am, and I'm trying to at the town, but everybody's being expedient today. No, you're being really fast. You're too fast for me, actually. So now we have our a presentation from Vancouver Coastal Health, and Johan is with us today, as he has been in the past. So welcome. This presentation is on capital asset management and planning, Vancouver Coastal Health, and there are a number of other personnel from Vancouver Coastal Health and some partners in healthcare in the audience today. So I'll leave it to Johan to do the presentation, maybe introduce others. Thanks.
Thank you very much, sir. I think we can. Would you like to have a quick introduction? Yeah. Thank you. If I can just ask the VCH staff if you can just introduce yourselves quickly. I'm sorry.
Good afternoon. My name is Sam Samsomi. I'm Director of Capital Projects for Sunshine Coast and Central Coast with Vancouver Coastal Health.
Yeah, nice to meet you all. Richard Gage, I joined Vancouver Coastal Health in January of this year as their Chief Project Officer, Executive Director of Capital Planning for Coastal. Nice to meet you all.
Good afternoon, everybody. My name is Leanne Calm, and I am the Interim Director of Care here on the Sunshine Coast. Thank you.
Thank you. Thank you, sir. With that, I will continue with the presentation. Do we need to see it? Do you guys see it on the screen? Sorry. Okay, no problem.
Technological issues today, I understand. So we all have the hard copy, or we have it on screen, because, fortunately it was submitted to us before. So it's the same slides, and
it's exactly the same, yes.
Yeah, if anyone's following at home, call up your agenda and go through the slides, that are in the agenda.
Thank you. Just stopping on page 1 here, aligning with our investment strategic priorities. These are the strategic priorities for Vancouver Coastal Health, namely healthy people. That is investment in prevention, predominantly, exceptional care to really provide exceptional care, expand our capacity for research, and a great place to work with the emphasis on retaining and attracting medical staff. The principles of the capital planning portfolio as such is all about the whole cycle of the facility, from planning, design, RFP, through to constructions, operations, and then eventually end of life of the building. So informing us along this route is the operational sustainability of the asset, the actual condition of the assets, which refer to some of our historical facilities that we have at the moment. Some of them are 40 plus years old. And then the engagement of Indigenous health, basically in how we do and deliver our capital projects with that engagement. Planetary health, where we can. We actually build for sustainability and being climate resilient. And then lastly, an example of diversity, equity, and inclusion, which we strive for in the delivery of our projects. An example of that would be washrooms and change rooms designed for the appropriate people and use. The overall risks and opportunities that we have within capital for Vancouver Coastal Health is the expansion of services and programs across across various programs that is simply not keeping up with our funding allocation that we are getting. So that creates challenges. We are also challenged in terms of delivery, in terms of some of the larger initiatives. And we have definitely fallen behind in terms of our infrastructure, both on the facilities and IMIDS side. And then, needless to say, there's the impact of tariffs on our capital project and equipment purchases. And then when we look at the opportunities, we're looking at ways to really leverage the planning around the infrastructure so that we put the money at the right place. We have had minor increases in capital funding over the last number of years. When I say minor, I'm talking about $2 million to $4 million on an annual basis. So that is not substantial. And we are looking at alternative funding options where we can, but we are severely limited in terms of our ability not to go out and borrow money as a health authority. And then we continue to build and strengthen our relationships with our First Nations health authority. And just in terms of the tariffs, there is a mitigation strategy in place that the on a provincial and national level that the government is working on. So it is not at a health authority level that we are dealing with those. We essentially defer it to a larger body. For this current year, we are today on July 17th, and we have not received a capital funding letter from the ministry. That is very unfortunate, and in view of that, we have to date not allocated all of our funds that we have received because we are sitting with a notional funding letter from a prior year, which we are dealing with. So currently, we have allocated $9.2 million of that routine capital investment funding to the coastal community of care, and that's about 22% of the allocation. The focus for this year and the coming years, as has been some in the past, the emergency department renovations, as you have experienced this in your community, we have had that happening. Surgical services is a huge focus. Community services, which is expanding all over. And then still we are focused on our infrastructure deficit and trying to find a balance between what we need, where we need to keep the lights on and where we have the potential to actually renovate or expand. And then mental health and substance use, diagnostic imaging and long-term care, those are the focus areas. This is a quick snapshot for coastal COC. So this is inclusive of Lions Gate, North Shore, Squamish, Powell River, Pemberton, Whistler, and Seashot. The biggest driver here is Hilltop House that sits in the outer years, which we are hoping will commence around fiscal 27 next year. With reference to the 9.2 million that I mentioned 2 slides ago, this is the actual list of the projects that were approved for Coastal. Unfortunately, at this point, there is no new project added to the list from this allocation towards Sunshine Coast. Let me just clarify, as I'm saying that, we have not completed the full allocation for this year. We are awaiting a funding letter update, and then there will be another executive direction in terms of further allocations. But to give you a snapshot of the 9 million, 5.7 of that is actually dealing with additional funds that we had to put towards projects that's in existence, it's continuing, that is challenged and need additional funds to be able to complete for various reasons. And this is a little bit of a snapshot of the overall capital plan. We are working on master site plans, or really health vision. My mistake here. It should be saying health vision. So that is happening across various communities, including yourselves. We are, as I've repeated now, focused on the infrastructure deficit, and we're looking at regional strategies for long-term care to address the demand. On the equipment side, medical imaging is a huge focus still in terms of trying to find a longer-term strategy for the replacement of our basically bread and butter medical equipment. And on the IMITS side, we are working on a huge voice system upgrade for Coastal. And at the moment, the ERP system that is managed by the Ministry of Health has been deferred for right now, but it is still an approved project as we see that. The rollout is probably going to be delayed by 2 to 3 years. That's the expectation. I included this slide just to give you an overall view of the total capital plan for VCH and PHC, and the predominant driver here is really the priority investment projects that we have, which is things such as the new tower for Lionsgate. We acquired some properties. We have the St. Paul's Hospital redevelopment. We have Hilltop. We have other care facilities underway. And then I'm just going to get into a little bit more detail specific to Sechelt Hospital projects. This is a listing of the facilities projects that is currently underway for Sunshine Coast with the appropriate funding sources allocated in the columns that you see overall. So that is a 10.6 million roughly investment here at the moment. These are the projects that have completed. Some of these are really a little bit older, so my forgiveness for the Shorncliffe reference here as that facility is closed, but the project actually closed recently. As this was, you guys may remember, it was a federally funded initiative when we were dealing with the excessive heat a number of years ago. On the equipment side, there's quite a bit on the move within minor capital. I will highlight the Sunshine Coast contribution here, which I will speak to a little bit later and give a little bit more detail around that. And sorry, let me just reference it. It is with reference to the 250,000 allocation that you make on an annual basis towards minor equipment. The completed projects include the following. I will highlight here number 6, which is the ultrasound that is funded by the Hospital Foundation. And further in the presentation, there is a cost share request, which I am actually removing from this table due to the fact that this project is funded by the foundation at 100%, and that was completely my oversight in terms of when I was compiling the presentation. And this is with reference to that minor equipment allocation. So in January of this year, Michelle Stanton was presenting to you a minor capital equipment list. And at the time, the SCRHD staff informed us that they had 483,757 available. So I'm sorry for the clutter on this slide, so I'll try and explain it to you. If you're looking at the first set of columns to the left, that is as it was presented to you in January of 2025. So we actually gave you a list that exceeded the available funding. So the list was 532,000. So what I have done with this slide is to say to you that we are building all of this within the allocation. Everything else that we have purchased, we will be finding another alternative funding source for those. So at the end of the day, we will have, as you can see by the arrow there, just a couple of thousand left over, which I'm assuming will carry forward into next year. So in January, we will probably come back to you with a prioritized list for FY26. I'm skipping over this one, so this is out at the moment, and then I'm going to hand over to Sam to just quickly address the health vision. Thank you.
Thank you, Johan. I hope everyone can hear me properly. Speaking about health vision for Seychelles Shisha Hospital, the objective of this exercise was to develop a clinical services plan and a functional program, an infrastructure assessment including gap analysis to inform options and recommendations in the resulting health vision for the campus. And the health vision will proactively plan for future long-term health and wellness needs of the region. In order to add a little bit of color to this, what it takes to develop a health vision and what was the approach to arrive at this at a very high level. Health vision is a methodical approach to looking at our existing services that are being delivered on the campus and considering projections for future growth and populations and trying to align those services for the future growth. And as part of this exercise, we look at the existing data that Vancouver Coastal Health has in terms of demands on particular services, being psychiatry, maternity, and so on. And then that is also accompanied by statistical data looking at population growth and the projections associated with different age categories that would in turn translate to future demands and the services that are being delivered on campus. This will form what we call a clinical services plan, which then is translated to a functional program, which is essentially the space requirements to deliver those future services. We also look at our existing facilities and infrastructure and the buildings that we have on campus. We do a gap analysis and understanding the health of these existing buildings, and that contributes to the assessment. And this exercise is done by consultations with our clinical subject matters experts who on a daily basis deal with these cases, and also informed by engaging with the community and hearing from the community. And as you're aware, and it's stated on the schedule, a number of engagement sessions and surveys have been conducted, led by VCH Communications team. And we have incorporated those feedback to confirm our findings and building on the information that at the end will be presented. This has also been with consultations with our nation partners who are major stakeholders in these discussions. And if you look at the schedule, the Gantt chart that is provided for this, it lists the major activities. And as it states, we're currently towards the end of the exercise, and we expect to have the information completed by end of 2025 or early 2026. And the benefit of this exercise is that it provides a vision. So when it comes down to making operational decisions or capital investments for various initiatives, we have the data and science and engagement with the community to make sure that it is a timely decision and it's an informed decision. And this will guide us in the future. It's going to be a living document that will be updated based on changes in demands of services and so forth. And this will guide us into the future to ensure that the services that VCH is providing is in line with the expectations of the community. And the next few slides are included just to demonstrate for context, what the campus that this exercise was focused on looks like currently, what the footprint is, and some specifics in the following slides, speaking to the age of different facilities. The North Tower was constructed in 2012 versus the South Tower in 1962, and obviously it requires different levels of attention. And it also illustrates on slide 29 that where we are with respect to the overall process. So we started with our visioning and the mandate we were given by our leadership. And as Johan spoke to, this was across several communities, Sea to Sky, and that is well advanced. Seashell is almost completed, and then we'll envision to have the same exercise for all the other coastal communities. And we are essentially on slide 30 on step 3. So just last week, we had a presentation of our findings on the clinical services plan, and after incorporating what we heard as part of that conversation, we are going to revisit the clinical services plan and basically ensuring that we've captured all the comments, and we should be then in a position to finalize that. That will guide, as I mentioned, our future decisions for the campus. With that, I will hand it back to Johan, please. Thank you.
Thank you, Sam. The last piece is just a touch on our project intake and prioritization process. So I will not spend a lot of time on that. We are now on slide 29. This is the timeline for next year's prioritization process. So despite the fact that we are at a point in time where we haven't completed this year's process, we still have to initiate next year's process at the same time. So that will commence in September, and typically we are hoping to have that finalized by the end of the year for a presentation to our board in FY26 around the February timeline. I'll quickly stop on this. This is the criteria that we are looking at for facilities, major clinical equipment, and IMITS projects. Very similar, I think strategic alignment is the key that stands out for all three. And more specific, for a facilities project, the elements that we are looking at is urgency, level of readiness in terms of has the planning been completed for the project, how ready is it to go to tender, those kind of questions, the impact to operations, the scale of that impact, and any potential operating cost impact or benefit. Those are essentially the things that we are looking at and determine a score and then measure the projects. And I will stop there. The rest of this is soft noise in terms of the background. So thank you very much. Thanks for your time. Open to any questions.
Thank you. I'll look to directors for any questions, and raise your hands in person, please. Director Inkster's first.
Yeah, thanks. I tried the electronic. I tried the electronic thing. It's not up, so I'll raise my physical hand. Just a couple questions through you, Chair, to Johan speaking to us here today. He mentioned a couple of things, the equipment replacement. In one case, it's equipment that can still be used, but they want better equipment and newer equipment. I'm wondering what happens to the equipment once they do that. Do we try to resell it, or do we try to distribute it, much like, I guess, fire departments do to other places that may need the equipment in BC, because we're all one large community in British Columbia and funded by one source? That's my first question. My second question...
Let's just do that one right now, and yeah.
Okay,
yeah.
so I can address that one. So typically, depending on the condition of the equipment, it's either traded in. The alternative also, which we see more of, is that Biomed actually retains the equipment and use it for spare parts. There is also a recycling associated with the equipment. That's absolutely when it's redundant.
Okay. Yeah, okay. I wish there was the alternative of providing it to hospitals, maybe in the north, that would need it. Okay, so my second question is tariffs. It was referenced, and I'm a little confused because I know they're counter tariffs, that if it's equipment coming to Canada, they're counter tariffs, not Trump tariffs. So I'm not hearing a lot about that. I'm not clear what that means. I'm hoping that the government decides, because once again, there's only one funder and it's the government. So we're imposing external tariffs on ourselves. And so I'm interested in to see how that rolls out, because if there's no local provider of that same equipment, that's two reasons why it doesn't make sense. Thanks.
Okay. I think that was more of a statement about federal policies, really, but if you want to comment on that, Johan.
I honestly should not. It's we are strictly working directly with the province, and we providing that information to them. And actually, within the last 2 weeks, was only once that I have seen an actual invoice with a charge for a tariff.
Okay.
So I really do not have the knowledge to be able to speak to it.
Yeah, okay, Chair, that's one issue. It just doesn't make a lot of sense on medical equipment for me that we need. There's only one taxpayer, and there may not be a Canadian provider of that equipment. So if there's tariffs on that, it doesn't make a lot of sense, and we should be thinking about that. We're taxing ourselves on equipment to provide to our public that we dearly need. So it's problematic. Thanks.
Thank you.
Director Bax.
Yeah, Director Inkster makes too much sense. Absolutely. I'd like to draw your attention to slide 24, which is the site plan, the buildings on campus. You have the mental health addictions trailers marked in purple as a temporary structure is likely to be demolished first, as well as Totem Lodge. Now, I don't know exactly what's going on at Totem Lodge, whether it's an active facility at the moment or it has a plan to become an active facility. But I do want to bring forward statistics that I read that I was presented with this week by the RCMP on mental health interactions that they have had, and there was an increase of 280% in their mental health interactions. And I know that the mental health of our citizens is not getting any better, and there's a real need for the facilities to deal with our mental healths and addictions. And I wonder if you could explain, if the presenter could explain to me a little bit about what the future of our mental health delivery is going to look like.
I'm going to hand it over to Sam.
Through the chair. Okay, thank you. With respect to the existing condition of Totem, and you may recall that both Totem and Shorncliffe were decanted about a year or so ago, and the residents were transferred to Silverstone facility. And we've done and we continue to do assessments of the buildings, and they are from the 1980s, and there's some infrastructure and envelope repairs we've done to the Totem Lodge, which because of its nature of being on campus provides a strategic advantage to repurpose that. Now, as part of the health vision process, we're evaluating the future use of both of those facilities. And with respect to the question about trailers, that is also being considered as part of this evaluation, but we're not at a point where we can, substantially share what that decision is. And we, to your point, Vancouver Coastal Health also recognizes that mental health and substance use is priority for the community. And at this time, it is being considered as one of the major candidates for the Totem facility. However, as I mentioned before, that decision is not final, and we still need to go through, various operational and capital evaluations to ascertain that. And the second part of the question, if you could repeat that, I don't think.
I think it was more, the approach to mental health in general. I mean, you've addressed this specifically with Totem. It'll be in the health vision, I'm sure. But I mean, if you can relate what's kind of coming in there.
Certainly, I can say that Vancouver Coastal Health recognizes the importance of it for the community and the need for the community. But in my capacity on the capital side, I can't really speak to the clinical plans. However, yes, it is being considered as part of the health vision. Thank you.
Other questions? I mean, I think following right up on that, just looking at the timelines and the fact that we don't have capital, you don't have capital yet from the province, and looking at the timing of the vision and everything, I mean, I think, can we still be fairly confident that we'll be able to keep moving forward with renovations to Totem? I know there's a lot of uncertainty around restraint going on at the provincial level. I mean, has that slowed down plans at all or concerns? Because I know work has already started to be done to Totem in anticipation of repurposing it. But are we in a position now where we're just on hold for indefinitely, I guess is a key word, and that's a concern I have.
I would suggest, Chair, that it is considered a priority for Vancouver Coastal Health. I don't believe there's a hold on anything. However, we do need to go through the process to inform the decisions and build all the material that would substantiate the case of working with the province for funding as part of the normal cycle we have. And I would have to say this is where we're at. I don't have any indication of one way or the other. And again, when it comes down to mental health and substance use, it is a candidate for that because of the importance of it and the advantages of it being on campus.
Okay, and yeah, I have one more, and then I'll go to Director Bax, and I'm asking this on behalf of Director Inkster because I thought it was going to be his question, but it's my question too. We always want to take every opportunity we get to ask about Shorncliffe, especially the District of Sechelt representatives who are very, very sensitive about this facility being empty and this potentially this valuable facility being empty. And I know that's something Vancouver Coastal Health is very concerned about too. But looking at the budget timelines and the focus on totem, I mean, really, are we? And the timing of the health vision too. I mean, the health vision will come out and talk about needs, no doubt. And the way I'm looking at probably how the process is going to work is the health vision will come out identifying some needs, and VCH will look at how maybe some kind of repurposing of Shorncliffe might be able to meet those needs, and that kind of planning might take another year. Hopefully a year from now, we might be looking at the next capital plan coming forward to actually do some of the work. Is that, would that be generally?
That's likely, probably somewhat realistic. I think you probably need to look a little bit beyond that, maybe a year or two for that to unfold. I am not that familiar with the timeline that we are targeting for completing the health vision, and I think that will inform some of the priorities post that. I can re-emphasize, and I feel that I want to say that totem is a priority. Totem is the #1 priority for the coastal community of care, to be specific.
Are you following up on Shorncliffe? Sure, if you want to go that way. I'll just jump. Sure. Yeah.
I'm glad there's a number of us talking about that, because obviously it's important to the entire Sunshine Coast community if that's repurposed. I'm quite close to Shorncliffe physically quite often, and it looks like the fencing around it has opened up, so I don't know what's going on there. There's somebody going in there to do some work. And we do need to make use of what's a decent building. I'm leery that, well, the building will start to disintegrate if it's not looked after. So that's my big concern. So I'm glad we continue to talk about it. I hope it's on your radar. And I will add, Chair, is that when I was at AVICC, and we all remember the fire alarm that went off, that gave me a good opportunity to corner the health minister. And so a number of us know Josie from our time in office, and I asked her if she would come to the coast in specificity to that particular project, because it's really important to our community. And what she said that and so I've asked about it, if Ms. Neal invites her, we can arrange a time where she can come and talk and look at those facilities and talk about them with us to make sure that they're not forgotten. So that's something we may need to remind our MLA and or the others or ourselves to invite her to come to make sure that that work is done. Thanks.
Yeah, well, I'm glad you changed it to facilities, because apparently as of today, we still don't even have the funding for totem yet too. So we need to cross that bridge, and then worked on Shorncliffe as well. Director Bax.
Thank you, Chair. That's some top-tier advocacy from our director from Seashell. That's fantastic. I will not go there. I do look at the Gantt chart that you have on page 22, or it's, yeah, it's the Health Vision Seashell Hospital. And I notice that your phase 2 engagement straddles the months of June and July. And so is there a public engagement that's currently going on, and it looks like it's scheduled to end at the end of this month? And if so, where can the thousands and thousands of people that are tuned into this meeting go to engage in this public engagement?
There has been a number of engagements with the community, whether through surveys or presentations and so forth. The latest one was last week, where the presentation of our findings was made to the public, and they had the opportunity to ask questions, and the questions were responded to by various experts from clinical as well as our leadership that were on that call, and we've tried to address those questions with respect to Health Vision.
So basically my question is how can the public which uses the health facility engage with this in this planning process in order for you to understand what it is that they feel is their greatest need?
And I think the answer is they have been.
Okay.
Yeah, this isn't an announcement of the process starting. It started
Yes, okay.
months ago, yeah. And there's been a lot of advertising for it. And, I mean, do you have any numbers on the engagement? That might be helpful.
That'd be helpful. Thank you.
Chair, I don't have it with me. However, I would point out that in the Gantt chart, it states phase 1 engagement, phase 1 report back, and then the phase 2 engagement. So these point to those engagements that were done, and now how they were done were through different means. As I mentioned, through surveys or engagement with the public or presentations in communities and so forth. But that's exactly to your point, Director Bex, is the importance of it, that we wanted to hear from the community, and we wanted to reconcile what is actually happening with the community, informed by what we hear from our clinical experts, as well as the data, so that they all come together.
I don't doubt that. But one question I do have too that you brought up is the report back on the phase 1 engagement is due back this month. Is that correct? In the second line of the Gantt chart, the report back, the phase 1 report back, third line.
Yes.
It seems to extend to the end of July, and so is that when
my understanding is that they've got the input now. Generally, you have the input, and you're working on revising the plan or considering revisions for the next couple of months and in the fall, we'll be looking at an updated plan. Yeah. Director McMahon.
Yes, unfortunately, I missed last week's session, so I've been waiting anxiously on the assumption that it was recorded so that I could see the recording. Is that coming sometime soon?
I would have to check with the communications team. I don't think it was recorded, unfortunately. However, I was attending the meeting, and it was there were a lot of great questions coming in from the community, and but I can confirm whether that was something that was recorded, if it can be shared or not, to be sure.
And I did attend that session, the online session, and Director McMahon attended an in-person session in Gibson's, and I think it was a similar format, similar information was shared. It was just online. But of course, the questions are going to be different from the public at each one. It'd be always interesting to see that. But are there any more questions on the report? Seeing none, thank you very much. Thank you for joining us.
Thank you.
Thank you very much.
Thanks for having us.
Mm-hmm. And now there are a number of headings on the agenda that I don't think anyone has any No one's given me any heads up that you have any surprise motions or bylaws. Anyone have a bylaw? No? Okay. So we'll go straight to in camera. We have a motion to go in camera, and that is in accordance with sections 91K and 92B of the community charter, and those reasons are quoted on the front page of the agenda. I see Director Toth moving that and Director Bax seconding it. All those in favor? We are moving in camera. Turning to the public meeting of the Sunshine Coast Regional Hospital District. We have completed our in-camera portion. There's no items to release, and we are looking to adjourn the meeting. Moved by Director Toth, seconded Director Bax. All those in favor? Motion carries. Thank you.